Today's Good Health is brought to you by Sullivan County Community Hospital.
Today, we're at Sullivan County Community Hospital with an important topic today. We're talking about Medicare wellness visits, and I'm joined by nurse practitioner Gina Lissman. Thank you for having us in today.
Yes, thank you.
So I think the first question we have to ask is, what is a Medicare wellness visit?
Okay. An annual Medicare annual wellness visit is an exam where the patient comes in to us once a year, and we look at all the preventative measures that we could put in place for the patient. It's very individualized patient or visit for the patient, and we have much more of an extended time with the patient where we can discuss everything. But we look at anything preventative, such as mammograms, if the patient is up to date, colonoscopies, DEXA scans, where they look at the density of the bone to see if anybody's developing osteoporosis, which all of those are preventative measures. We also do lung scans on people that smoke or have smoked and have quit, but smoked within the last 15 years. So a lung scan is also provided, which is great. Lab work, we do lab work, annual lab work on the patient, such as lipid profile, looking at the cholesterols. Another blood test that we do is a CMP, where we look at the glucose with the patient, electrolytes, kidney function, things like that, that are early signs we can see things, and kind of step in. And you need to go see your provider, your regular provider, or we go ahead and order the test and do all of that. So we all work here with the providers, their primary care providers, and it's just a great team approach, really.
Sure.
Yes.
And when they come to this particular visit, we talked about all of these tests and all of these things, but these are kind of that follow-up from this initial meeting. So when they come here to see you, they're not going to get poked and prodded and all of these things, right?
No.
What will it look like with this visit?
We talk about all type of topics. I help patients put in play, their plan for the year. A lot of patients do natural things at home. They don't particularly want medication. So we discuss that and how we do still need medications, but we talk about their supplements, vitamins. A lot of people like to do that route to lower cholesterols, lower blood sugars, things like that. I mean, I've discussed everything, literally everything. Yes.
Well, and that's what it's supposed to be. It's a free conversation available to all those Medicare patients who simply, these are the things they should be doing to prolong their health overall, right?
Yes, it is. Yeah. And some patients that come in are on top of things and they've done really well, but we still find holes, what needs filled and things like that. And then the patient's actually mailed a copy of this visit so they can see their vaccination records. They can see their colonoscopy, their DEXA scan, mammograms, lung scans, all that type of thing. We do screenings for depression. We do cognitive screenings, meaning that, we can catch early signs, such as someone having a problem with thinking, remembering things like that. It's important to hit all these things early, very early. It can make a huge difference in their overall health. Sometimes, if a patient's in need, we do offer the care coordination also, which is another side of us. We have nurses who are able to call the patients in the community one time a month, and it is a great program where if the patient doesn't need anything, that's okay. The nurses either call them or go to their homes and visit them, whatever the patient prefers, and then we can help out with simply everything. It's an amazing program in this community that's available, and I don't think a lot of people are aware it's here. And it's, not home health care or anything like that, but it's a good program.
So how does someone schedule this wellness visit?
They can call Sullivan County Community Hospital, ask for the care coordination program, and they call over here and we get them scheduled.
Now, do they need a referral to do this?
No, they do not need a referral. Nope.
But when it comes to their primary care physician, you are really working in conjunction with everything they do with this patient.
That is correct.
Right?
Yes. We definitely want to work as a team with their primary care and just look at, we all work off the same system here. We share everything. If there's anything important or I need to send a message to one of the primary cares, I also do that.
Wonderful.
Yeah, and then when the lab work comes back, we are responsible for calling the patient. I review all the lab work and all the testing, and then our nurse here calls the patient with those results. So that lets a little bit of a load off the primary care doctor, so they don't have to worry about, doing all the callbacks and things like that. They have enough on their own usually.
Okay.
Yes.
I feel like here at Sullivan County Community Hospital, you all have done a great job of coordinating to make it not only easy for the patient, easy for the physicians, and hopefully make everybody's quality of life just that much better.